amongst Christians, but MBN, it's our mission to spread love and show you vision. And we cancel our division, and we hope that you listen, cause Mamlaka Broadcast Network brings you love and joy and love and joy. We cancel out the noise, and we giving you a voice, gives you love and joy and love.
Good morning, good afternoon, good evening. This is your host for today, Ambassador Victoria Esuba. I bring you greetings from a local studio here in Spain. Welcome. Buenas tardes. ¿Qué tal estamos todos? Today, I have a very special friend whom I met a few years ago in Florida. And given that we both have the same mother tongue, that is Spanish, we began to speak in our own language and we connected up until today. Her name is Miss Aida Cirino Lee. Welcome, Miss Aida. How are you, beautiful Queen Aida? How are you today?
I am doing great. It's an honor to be here today with you guys.
Excellent, excellent news. Okay, now let me give a brief background of who you are so that our viewers will know you a little bit better. Miss Aida Cirino Lee is a holistic health practitioner and an integrative nutrition health coach that has been working in the healthcare industry or environment for more than 25 plus years as a registered MA and lab technician in oncology, internal medicine, and urgent care. She also coaches her clients. And as a result of her coaching, her clients got the skills and power to control, prevent, and even reverse chronic diseases. She also is empowering them to navigate through our sick care system, healthcare system, I beg your pardon, and break bondages to medication and the side effects. So before we even begin with the topic of today, I would like for you, Miss Aida, to basically tell us, how did our King touch your heart? The floor is yours.
Yes, it was very weird because I was a single mother for 12 years. So my daughter was about 9 years old, and I had a neighbor, okay, that was a Christian. And the neighbor always was inviting me to church. But I was always, trying to ignore her. I always say, no, like that. So she always invited my daughter to any children program that they have or anything like that. So I allowed my daughter to go to the children program. Okay. So when my daughter, she was going to those programs since she was 9 years old. And when she was 11, she accepted the Lord at their church. Okay. So then she said, Mommy, I want you to go. Mommy, I want you to go. They're going to have a program. That particular Sunday, they were going to have the children run the church, do the service. Okay. And so my daughter wanted me to go because she was going to be participant of whatever they were doing in the church. So I said, okay, I'm going to go because I never miss anything my daughter does. So until then, I don't know, God, everybody's, the neighbors been 3 years, okay, inviting me, and I always denying it. So I go with my daughter that Sunday, and that Sunday went good. I told my daughter, I didn't accept the Lord that point, but something touched my heart. The following Sunday, when I went, they were singing that song that For Every Mountain, and I remember everything I have gone through and the things that maybe I didn't recognize before, that was God that taking me out of situations. And at that moment, it clicked. And when they did a call to the altar, that's when I went and I met the Lord. And I accepted the Lord. That was on January 7, 2001 at 10 o'clock at night, because it was a night service.
Wow,
that I accepted the Lord.
You are
So
very
I remember
specific.
the day and time.
Very specific. So how has your life changed since you met him, since you met our King?
In a lot of ways. Listen, I was single. I lost my house. I lived in a car. Okay. I was all by myself. I suffered a stroke. All that happened while I was on my own.
You suffered a stroke?
When I accepted the Lord, everything changed. I went from being alone to meet a man of God, to be married, from having one daughter to now having 5 children. to living in the street to owning my own house, from having a very stressful job to owning my own business and be working on my purpose and realizing the power that I have in me, the potency that God have applied in me, and how to grab it and be able to work towards it. You know, I think without God, I would never be in the way that I'm right now. I will not have what I have right now. And also, if I didn't go through the things that I went through, I would not appreciate the things that God have worked in my life. It is very important that people doesn't understand, because even the Bible says that we're going to go through trials and tribulations. But don't concentrate in the trial and tribulation. Concentrate in the way that God walked you through that trial and tribulation.
Correct.
And the things that you're going to learn through that trial and tribulation that is going to catapult you to the next step, to the next level in God. And that's
exactly.
why the way that I feel that God have changed my life in every aspect whatsoever. Before, I was, like I said, single. I was doing things that I didn't supposed to. Okay, doing things that I'm not going to be describing here, but doing things that I didn't supposed to. I was not, I was partying, and instead of, concentrating in the things that I needed to concentrate it. I have dreams that since I was a kid, I always wanted to be in the medical field, but I was not able to. I went to school and I did the registered medical assistant, the lab tech, and I was working on it, but I was not doing my purpose yet because I didn't know I could. I never thought I could. I thought it was something far away. When I came to Christ, and especially in the last 5 years that I came to know Pastor Miles Morrode, that I learned a little bit about what it is purpose, what it is the kingdom. Because, when they first bring you to God, most of the churches, what they do is they bring you to the door. Jesus is the door. And right there, you accepted the Lord and everything finished right there.
And that's it. Yes.
But when I learned that you can go past that door, and there's a lot that you can do here, that your glory can happen here on earth at this time, that the potency is inside of me, that everything that I need in order for me to be successful and to impact all these people's life for the kingdom of God is inside of me. That when I learned that, then I start searching and excavating to figure out what it is that I'm supposed to do until I found my purpose.
Amen to that. Wow, you have really shortened your life in a tiny little review, but you are very right in saying that your life changes, because at the end of the day, God is the rewarder of the faithful, and you have been faithful, and that is showing in your life, and that's why your life has changed so greatly. So to God be all the glory. That's all we've got to say.
That's what I said.
Right. So now we're gonna start now going into the topic that I want you to share with us today, and this is a topic that somehow has affected us all one way or the other, or it still is affecting us, and that is none other than the pandemic, the COVID-19 pandemic that started last year in 2020. 2020 has been a very, very rough year for all of us. We had a loved one, some of them got sick, some of them died, some of them went to hospital, some of them never came out of hospital, some of them never had any symptoms, although they contracted the disease. And at the end of the day, our body is our greatest weapon. I'm going to repeat this. Our body is our greatest weapon. So with this having said, I would like you, Miss Aida, to tell us how the year 2020 was for you. The floor is yours.
Oh my goodness. This year was a very tough year. I have lost 4 family members to COVID, plus 6 good friends to COVID. So a total of 10 people I have lost in my life for COVID. Not to mention that it also affected us in our house. Okay, so let me start by telling you, we took care of my father-in-law. In the last 8 years, my father-in-law been living with us, and we've been taking care of my father-in-law and his uncle, his brother, my husband uncle, both of them. We've been taking care of them for about 8 years now, and he was living with us. And one day he was here. He always used to walk, around with his walker to get some exercise done, and he walked around. And then he was walking into the house, he fainted, and he didn't fall on the floor because I caught him on time, but he didn't recover. So I called 911 to take him to the hospital. And my husband just walked in, so we called 911 and they took him to the hospital. When he got into the hospital, they told us that he was COVID positive.
Wow.
Okay, so everybody in the house went to check for COVID to make sure that if we have COVID. So we all check, and when the results came back, we all came back negative with a section of his of the uncle. So we took him to the VA because he's a veteran, and they hospital husband on. Okay, then I start feeling bad myself. I start feeling bad. So my husband said, let's all check again. Let's all check again. So he went to check. I went to check. I came back positive. And my husband came out negative and my son came back negative. But I came back positive. So I closed myself in a room. Okay. So that way my house is like kind of a split portion where the one room is in there, the other room is in. So I was able to close up myself in that room, and I had a door outside that I could go to the yard, to take some air and stuff like that, so I don't contaminate anybody else. Now, because I've been taking a regimen of natural medicine that I do with vitamins and things that will boost my immune system, I didn't get the I cannot breathe part of the disease. I got the fever, the sore throat, I couldn't smell, body aches and all that. I couldn't stand up from the bed, but I didn't get the no breathing thing that everybody else get. So it didn't reach to my lungs, which was good. But the process of the thing took about 3 weeks to leave me. While I was there, my husband said to me, Aida, I'm having issues going to the bathroom. I think I have a urinary tract infection. So I said to him, okay, if you have a urinary tract infection, you need to go to the doctor. So they give you something so I made him an appointment from the room, and he went to the doctor to get a prescription. So they gave him a prescription. He started taking the prescription, and 2 days later after the prescription, he's telling me, I have blood in my urine and I can hardly pee. And I said, you need to, let's count, your urine to see how it's going. And if not, you're going to have to go back to the emergency. So 2 days later, he couldn't pee at all. He was not peeing at all. So I told him to go to the emergency room. Listen, I have the COVID, so I cannot come out of the room. Everything that I did for my husband, I did it through the phone. Okay? Through the phone in my room. So my daughter that lived with me, his second daughter, took him to the hospital, and they admitted when they do his test, they said there's a test called CK, and that test, what it does is check how much of the breakdown of your muscles is happening. Okay, and we're supposed to have less than 100 because our cells are continually multiplying and changing. So we're supposed to have less than 100. He had 19,000.
Wow.
Okay, it was major muscle breakdown. The major muscle breakdown that was happening was so major that shut down his liver and his kidney. So that's why he wasn't able to pee. Okay, they put it in critical care. He was in critical care. They have to do an emergency. Now, in the emergency room, they did a COVID test, okay, and it said that was negative. And he already have another COVID test from home that was negative. And before that, once I came positive, he went and repeated again, to make sure. So we have one waiting, 2 already negative that he did outside, 1 waiting, and the one that they did in the emergency said that it was negative. He was in critical care. They put him to sleep, and when he wake up in the morning, he tell me, Aida, I don't know why, but they put me in the COVID floor. And I'm like, why they could put you in the COVID floor? You don't have COVID. You're coming for another reason. Why are they putting you in the COVID floor? So I go and I call the hospital, and I said, why are you putting him in the COVID floor? I need you to repeat the test because the emergency room said that he was negative. Oh, if they put it here, most likely it was positive. I said, no, because they called and they said that it was negative. So I need you to repeat the test. No, because once they're in the floor, I don't repeat the test until 6 days. Yeah, it's 6 days in that floor. He's going to get the COVID. And then you're going to get the diagnosis. Because if you don't know, if you're not aware, there is an ICD-10 code that they use when you have COVID that the hospital can get a bigger amount of money from the insurance for it. So you can go to the ER, and I'm talking here in America, okay? You can go to the ER for any reason, your pinky is hurting, your hair is splitting, and they find out a way to put that COVID diagnosis there somehow. And this is only my opinion, but I feel that that's the way it is because, come on. And then he wanted him to sit there for 6 days. By the 6 days exposure, knowing that his immune system now is low because his kidneys is not working, his liver is not working, he's in critical care. You leave him there longer, he's gonna get it anyway. So that way you can write that diagnosis. So I have to fight for them to repeat the test, and they didn't want. Then the next day, my husband said they put somebody in the room that is coughing and is in critical care with COVID in his own room. Okay, so I keep calling the hospital trying to get the test done. Finally, they decide they're gonna do the test. They do the test, but that's the same day they decided that he needed a permanent port to do the dialysis. So they needed to take him to surgery. So they took him to surgery. They do the test. They take him to surgery. While he was in surgery, the test came back negative. So I'm saying to myself, perfect. That means that when he get out of surgery, he's gonna be in the recovery room, and then they're gonna take it out of the wing of COVID. No, honey. You know what they did? He come out of the surgery, and they put it back into the COVID place. And I said, that's it. I didn't know what else to do. I called the doctors. I called everything. Now, my husband, oldest daughter, our daughter, oldest daughter, she's an attorney, and she happens to work in the firm that she worked in Tampa, in the department of medical malpractice. She happened to work in that department. So I called her right away, and I told her what's going on. We were all in contact, but I let her know that that's what happened. And she went and she called the hospital with her firm. Within 5 minutes after she called the hospital, they changed him to a regular room. So if we didn't have that facility there, and I wasn't paying attention for it, I feel sorry for the people that go to the hospital and doesn't have nobody to advocate for them. So it is very important for you, when you go to the hospital, that you already have somebody assigned that's going to advocate for what. Even when you don't know any medicine, you need to at least be in up to date of what they're giving to your patient, what they're doing to your patient. Because nowadays, with Google, you can search to make sure you can have an idea of what they're supposed to be given by
Correct.
Google. And when you see something that is not in what the regular things is saying, then you can fight for it. But it's important for us to make sure that we have somebody to advocate for us, because if I wasn't there to advocate for him, they probably were living there. He probably would have got the COVID, and he would have died out of that, because then that would damage his kidney more, and he would never be able to get out of the hospital. But things didn't finish there. Finally they put him upstairs to a regular room. A week passed. I'm already clear of my COVID, okay? And I wait a few more days to make sure that I repeated it again twice, and that twice came back negative before I can go and visit him in the hospital. So finally, I was allowed to visit him in the hospital. Prior to that, one of my daughters is a nurse. She worked in another hospital, but then she was able to check on his daddy. So that's another thing. It was not only me that was paying attention to the same hospital. She was making sure her dad is getting the things that he's supposed to be getting, and letting me know what's going on. They give this to daddy. They said, so it was a team effort, between my daughters and me working with him. Then finally, now I can go and visit him. So when I go and visit, the first day that I go and visit to him, he looked, he was already out of the critical care. He was already in the regular room getting his dialysis, and he looked pretty good. I had to help him a little bit to take a bath and everything, but he was looking pretty much, he was sad at the fact that he had to do dialysis and all that, everything because this is a person that was healthy. It's not that he had an issue with his kidneys before, or he had an issue with his body before, or that he suffered from diabetes or anything like that. No, he was healthy. Okay, he was healthy. So of course he was sad about the situation, but he was also in faith. My husband is a man of faith, so he was always in faith of what was going on. So that day he looked pretty good. I go home. The next day when I come, I see him that he cannot get out of the bed. His stomach is distended. He had a low-grade fever. He got diarrhea, and he told me that all night he be calling and telling the nurse about his stomach ache, and they haven't done nothing about it. So when I walk in, the dialysis nurse was there doing the dialysis, and I see that when he was doing the dialysis, he starts shivering, like shaking real violently. And I said, something is wrong with my husband. He went, and she said, most likely he's cold. I'm just going to warm up, because I didn't know. That's one thing I didn't know, because I'm not specialized in dialysis, is that when the blood goes back into the body, they can warm it up a little bit till it goes out warmer. So she said that she's going to warm up a little bit to go up warmer. So she did that. But my husband's still shaking. He's still shaking. His stomach still distended. She's still complaining about stomach ache. Okay. So when he finished, I said to her, check the temperature. Okay, he might have a fever. No, I don't think he got a fever, but I'm gonna check the temperature. She checked the temperature. It was 99.8. That's not really a big fever, but it's a low grade fever. But I said to myself, if it's a low grade fever, but the guy have symptoms. Oh, it's low grade because I put the blood warm. And I said, yes, I understand that. If you didn't have no symptoms whatsoever, I will agree with you, ma'am. But the fact is that he got a stomach ache, distended abdomen, and the day before, I forgot to mention, he got a little pus in the incision where in the port where you put the blood back in.
Yeah.
He had a little pus that they had to clean up. So I'm thinking either that pus come a little bit into the inside him, he got diarrhea, he can have a C. diff infection. And also my husband have history of diverticulitis. That's another thing. It is important for you to know your history. Because let's say that we didn't know that, they would not know that. And it was not even be the fault of the doctor, because what you don't know, you don't know.
Yeah.
You know? Yeah. But the fact that I know my husband's history, I'm able to advocate for him in a different way. You see?
Correct.
So I go and I tell that to the nurse, and then that nurse goes away, and then the other nurse comes in, and she told me, I'm gonna check the temperature in an hour. The temperature is still higher in an hour, then I will call the doctor, she said. An hour went by, an hour and a half, and she didn't come in to check the temperature. So I checked the temperature myself. Remember, I work in a healthcare field. I know how to use all the equipment. So I went and I took the temperature for him, and at that point it was 100.3 already. From 99 something, 100.3. I go to the nurse station and I tell the nurse, my husband have 100.3. How do you know that he got 100.3? Well, ma'am, because you're supposed to be there in an hour and a half. I pressed the button, you didn't come, so I took it myself. Okay, and she comes and she checked the temperature, it was 100.3. She told me, I'm gonna call the doctor now. And I'm gonna come back in an hour and I check his temperature again. An hour come by, I don't hear nothing from the doctor. An hour and a half, I don't hear nothing from the doctor. Okay, so I said to myself, okay, I went, because that first time when she came and checked the temperature, she turned off the machine, so to make sure that I don't use it. Okay, she turned off the machine to make sure that I don't use it. Not knowing that I don't know how to use, I hook up everything back on. So she don't come in an hour and a half, I hook up everything back on, and I check my temperature again to my husband. He got, this time he got 100.1.3. So it's keep going higher and higher, the temperature. So I go and I stand up in the nurse station. I say, I'm not moving from here until you call the doctor in front of me right now. Right now, you're going to call the doctor. She called the doctor, finally, and then I called to the doctor and I say, listen, doctor. I talked to her, she put on an intercom and said, doctor, my husband have a fever. He got pus yesterday in the incision. He have a distended abdomen, and he have diarrhea. He could have C. diff, and he got a history of diverticulitis. He can have, his immune system now is low. He can have a flare up. So you need to check for that. You need a CT scan for that. Oh, let me see. Let me call the infectious disease. So she decided to call the infectious disease doctor. And what do you think that the doctor ordered? Exactly what I told him to order. They ordered the blood culture to check that the infection didn't go into the blood from the pump. Then they did the stool sample to make sure that he doesn't have C. diff, and they did a CT scan of the abdomen. When he came back, the CT scan was positive and the stool was positive. If they will not do that, you can die out of C. diff.
Yes, correct.
And you have no idea how painful is the diverticulitis. He would have died if I wasn't there to know. That's why I said to people, it is so important for you to know your history. It's so important for you to have documented all your health history and everything that go past in your life, so that when you get into a position like this, and then not only that, you need to have a family member, one inside of your house and one outside of your house, that have access to that information. So when you go to the doctor, when you go to a regular doctor visit, you are here in America, you are the owner of your records. So you are entitled to ask the doctor when you leave the office, I want a copy of my results and I want a copy of the doctor visit. Why do you want to do that? Because in a situation like this, let's say that the infectious disease would have come, I didn't know nothing. Let's say I didn't know nothing. The infectious disease probably would have discovered the CD, because you can visually see diarrhea coming out. Okay. And he probably would have done the blood culture because he can physically see the pus in the thing, but he will never know about the diabetes, the diverticulitis.
Yes.
because it's something that I was able to tell because I know his history. So that's why it's so important for us to make sure that we have a folder in your house. When you put all your health history, your folder is supposed to have your doctor notes, any results they have done to you, any labs or imaging that they have done to you, and on your health history, meaning what happened, your mama and dad, what they suffer and stuff like that. Your list of medications and supplements that you take, okay, it's supposed to be there. And the names and addresses and fax you see. So in health, have that information. Hospital can do an informative decision when it comes to the diagnosis. We are responsible of our own health. Imagine you giving a doctor all the responsibility of your health, a person that might see you when they go to the hospital, they're there for maybe 5 minutes in the room. All the documentation is done by the nurses. And if you have nurses that doesn't have a good clinical eye, and noticing that, because the nurses that were watching my husband didn't have the clinical eye to decide something is wrong.
May I interrupt you there? Why do you think, speaking about the nurses, why do you think this is happening? Because what you're describing to me concerning the nurses, I've heard it before and I've seen it before, that there are certain nurses, that they don't do the job properly. And I'm not sure whether it's a case that they can't be bothered, they are tired, or there's a shortage of nurses in hospitals, or there may be something totally else. I don't know. Can you ponder on this if you do have any information?
I think it's a combination of everything. There's some shortage in some hospitals. They giving too many patients per nurses, but we also have, nursing is a very privileged career when it comes that they pay good. Here in America, nurses get paid good, and it's a job that you always will have a job. So a lot of people, when they go to school and they don't know what it is to have purpose and have a calling by God, they go to what can give me money, but might not be your calling. And because it's not your calling, you go by the book. You don't have that extra, it's something that the Holy Spirit give you.
Yes.
You know what I'm saying?
Yes.
And if it's not your calling, you can learn something. I can probably learn how to sing. I might do something. Believe me when I tell you, I have no. So that's the same thing that happened when it comes to nurses. It's a combination of everything. That a lot of patients per nurse, the fact that they are tired, the fact that they have to work a lot of overtime, and the fact that there are a lot of nurses that's not their calling. They're doing it because it's a career that's going to give me the money, and I'm always going to have a job.
Okay.
So they're willing to do, exactly what is by the book, and that's it. They don't get out of the box, and that's what's happening. And not to mention that medicine nowadays, in the way that they teach, because I did pre-med because my goal was to become a doctor, but life didn't take me that way. So I did pre-med. And the thing is that in school, they don't teach things like the clinical eye or nutrition, for example. And they teach a class of nutrition in undergraduate, okay? That is, you take for 1 semester. And after that, you still take another 8 years of school. By that time, you already forgot everything you learned in that little class. That's the first thing. The second thing is that the way that they teach here is diagnosis, matching medication, diagnosis, matching medication, diagnosis, matching medication with a protocol. So let's say you have diabetes, I have diabetes, and Victoria, another person have diabetes. We can have it for different reasons, but we all going to be treated the same.
Yeah.
See? So that's the way medicine works. And I'm talking here in the United States. I'm not, proficiency in
I believe that it's a template. It's a corporate template that is everywhere. It's not just in the United States. I believe so. But at the end of the day, like you said, there are different people. There are people that they have purpose in the healthcare industry and they're doing their job correctly. And they have that clinical eye that you have been referring to. And there are some other people that are just there because there is money in it. And there is going to be a job for a lifetime, because the way the health system, I'm not going to even say the health system, but the way the pharmaceutical companies structured, they are structured in a way that they keep patients sick, so that you have to keep coming back to them. And they don't train doctor, not just doctors, but medical field, whether doctors, whether nurses, they don't train them in a way that they need to go beyond the protocols that that established by the media, by the medical establishment. So it's a shame. It's a shame because, like you said, everybody's unique and every disease is unique and it should be treated. Even though that within the protocol, you need to know, obviously, you need to know the protocol.
Yes.
Every disease and every person reacts differently, and therefore it needs to be treated differently. And you need to really have the eye, like you said. So please continue because I have interrupted you. Please continue.
There are doctors out there that want to do the best, and there are doctors that want to go out of the protocol. But the problem is that even then don't have the authority. They have even taken authority away from the doctors, because here in America, the insurance and big pharma and insurance control the doctor. Big pharma tell the insurance these are the medication for this, and then the insurance tell the doctor, if you put that diagnosis, you need to give this, and this. And if the doctor don't follow those, he might not get paid.
Yes, I understand. I understand.
Or
That's
that
what I
problem.
said.
So the doctor
has to follow protocol.
Yeah, he have to follow weather, and then the doctor that don't follow protocol, somehow they get fired, somehow they get into any issue, and they don't get to do what they're supposed to do. But there's some of them that they will go. I work with ones that will fight. They will be, I'm sorry, but for the word, but they'll be cursing the insurance in the phone and doing whatever they need to do to get what they want for the patient. Yeah. But then you got the other ones that go by the book. Even though that they know that that's not it, that they should do, they go by the book anyways. Like, for example, let's say the doctor knows that you need an MRI for something, because he knows, and he knows by clinical you might have a tumor there and he wants to see it correctly, so he wants an MRI. No, the insurance is telling them, no, the patient need an ultrasound, an x-ray first, then an ultrasound, then a CT scan, then he can go to an MRI. By then, you know how much do the insurance have to be paying? I mean, the patient have to pay copay for every single thing that they go through, that might not see anything. And because he might not see anything, then he will not pay for the next one. Because if you don't have a reason or a good diagnosis to pay for the next one, then you will not do it. I mean, it's just, and let me tell you, it doesn't finish there, because now my husband come home on dialysis, okay? And he need to get dialysis 3 times a week. And they tell me to go to the outpatient dialysis. So I go with him the first visit to the outpatient dialysis, and he had to spend 4 hours, okay? Anywhere from 4 hours to 5 hours every day he goes. Every single time a patient get dialysis, when they come out of dialysis, it's like they are so weak. He can do nothing else but sleep.
Yes, I know.
I had to drive, I had to stop my business, everything. I had to put everything on hold because I had to drive in and bring him back and, do the things that I had to do to nurture him back to health. But when I go I'm going to tell you how this medical field is. I go there to the first date, and there's a medical nutritionist there that's going to give you a lesson before you go in, and the tour to the facility. She gave me the tour to the facility, to the snack bar for the patients are there. The snack bar, girl, let me tell you, the snack bar is 2 vending machines with Doritos and Cheetos and Starbucks and M&Ms and Snickers, okay? And then another vending machine with Dr. Pepper and Coca-Cola and Pepsi and 7-Up.
Very healthy, extremely very healthy.
I told her, I told her, why are you giving this kind of food to the people that are here taking dialysis? 99% of the patients that need dialysis or that have kidney failures are because the main causes are because of diabetes uncontrolled or hypertension uncontrolled, meaning that too much salt, too much sugar.
Too much sugar, yeah.
Okay, and everything that you have here either have too much of the other or have both. So why do you, this is the way she answered to me. Oh, don't worry, because they're taking the dialysis right now, and when they take out that blood and they clean it up, they clean out all the garbage. That's the answer that she gave me. And I said, ma'am, don't you understand that before the garbage getting into the blood need to be metabolized by your body? That means that if it need to be metabolized by your cells, I mean that whatever garbage you put in that cells already causing the damage into the cells, and all you're getting is the leftover.
Yeah.
Okay, so that means that this is the way that that's why people can never get out of dialysis. Once you're in dialysis, 99% of the time you're there forever until you get a kidney transplant. And that's what they told me. For the prognosis that they give to my husband was that because he didn't have any prior kidney failure or anything like that, he wasn't having any kidney problem, that he might be able to improve his kidney function, but they said that he will always gonna have kidney problems, and they don't know that he could be in dialysis for a year, 2 years, 3 years, that they don't know how long. That's the prognosis they gave to my husband. Listen, I didn't listen to the diet over there. I put my husband in a strict diet where I counted the phosphorus, the protein, the potassium, everything. I had everything signed down. Within 3.5 months, my husband was out of dialysis. His kidney function was totally back. Okay, totally back.
Wow, I'm amazed. Like I said, knowledge is key to everything. Knowledge
And this
is
is all
key
for the
to
glory of God.
everything.
This is all for the glory of God. It's not because of me.
Amen.
It's not because of me. It's just that God gave me the knowledge.
Exactly.
You know, the knowledge, and allow me to understand it so that I can put the wisdom of God to work. You
Yeah.
understand what I'm saying? It's not because, oh, Aida knows it all. No. It's because God put a knowledge in me, and I was able to use it properly because of the ability that the Holy Spirit gave me to be able to do my job. So it's not me. It's all for the glory of God, that I was able to put things to practice and create the diet for my husband to come and be able to. And then once he got his kidney function, then we needed to work into getting his muscle mass grow, because my husband worked for the airport. He worked for Delta. He's the one that changed tires, put gas, do luggage, all that stuff. The ground server in Delta. And because he do a lot of weight, he used to have an upper body that like a bodybuilder because of all the muscles that he lost all of that. I mean, it was like jelly, everything. So now we have to work back into getting his body
rebuilding the
built up.
muscles. Yeah.
So we started. This is how insurance works. I'm telling you, it sucks. We needed to go to physical therapy. So he started doing the physical therapy. And because when we changed to 2021, every year you need to build up your first $5,000 of deductible. So remember, he wasn't working. I was not doing much in my business. Thanks to God, we are not in a situation because we had savings that we're losing house or anything like that. No, but we don't have the extra money either to to do all that. So when the year started, then they quit the physical therapy because we had to pay almost $200 every physical therapy. And he used to go 3 times a week. So I said to myself, okay, baby, don't worry about it. I find a gym that had the machine that can test his muscle mass, because he needed to go to the doctor back with his muscle mass all the time. So that way he can go back to work. So I find a gym that do the muscle mass test. I went and I learned the exercise that they were giving in the gym, in the physical therapy, and we started doing it in the gym. And within 3 months of his doing that, he was able to pass the physical test to go to work.
Hallelujah. Wow. So I take it that your darling husband is very well right now.
Yes, he's doing really good, like working to get his muscle back the way he was, but he's doing really good. He's working. Of course, now I work because he just went back after 7 months of not working. They put him in light duty. So he's just gassing up the planes and, doing things like he doesn't have to lift too much. They put him like that. But at least he's already passing their physical, so to be able to go to work. And he's doing really good. We continue to do his diet, making sure we're washing up the things that he eat. Because the fact that's another thing, because God healed you, that doesn't mean that you can do whatever you want. Because that's another thing that happened also in the Christian community. God can decide that he's going to heal you right away. He can do a miracle and heal you right away. But because he healed you right away, now doesn't mean, okay, God healed me from diabetes. Now that means I can eat cakes and sugars and
no.
Understand, this is the temple of the Holy Spirit. Okay, will you invite Jesus to come into your house, into a house that is all messy and disorganized and dirty and clogged? No, you wouldn't do that. So why are you allowing that to happen in your body?
Correct.
Why you allow that to happen in your body? That's why it's so important. And another thing I want people to learn is that, remember, the doctor is just one person. You cannot leave the doctor all the responsibility of your health. And this is something that happened, especially a lot in the Hispanic community. We tend to see doctors as gods, and whatever say goes. Listen, this is a human being that can make a mistake like you and me. So in order for you to help him out, You have to come prepare to the doctor with all the information that he needs so that he can make a what I call an intelligent and informative diagnosis and treatment for you. Because if you don't come with the information that he needs, he's gonna try to work with whatever he has, and it's not enough sometimes. That's why they end up doing the wrong thing sometimes.
Yeah.
You know, you come to the
True.
doctor visit. Let's say you suffer high blood pressure, okay, and you come in from the doctor visit to get your follow up for your blood pressure. Please come to the doctor with a log of how your blood pressure been in the last 2-3 weeks prior to that visit, so the doctor can see the medication he gave you is working. Because if you go there and you get and he read your blood pressure, the nurse read your blood pressure, it's high. The insurance is telling him he need to give you another medication. He cannot let you go without your blood pressure being low. So now you're getting another medication with more side effects, okay, that you probably didn't need it because you didn't bring a log.
Yeah.
Because if you would have bring a log that your blood pressure was doing good at home, and that day, because sometimes we get nervous, sometimes we don't realize that we're nervous, but our body get nervous, and you get what it's called here in America white coat syndrome. That means that your blood pressure just get high at the doctor's office only. Okay, then the doctor can say, oh, she don't need that because it's just that she's nervous. You see? Or for example, another thing that happened to a lot of patients, especially the elderly, they go to different doctors, okay, and they don't bring their medication to every visit office. What happens if you don't bring a clear list, or at least the bottles of the medication? That's important. Why? Because the doctor don't know what other doctor give you. They try to communicate, but remember, it's not the doctor that doing the communication, it's the staff. And if they have a lousy staff, the communication is not going to happen. If technology is not working correctly, the communication is not going to happen. So you need to bring all your pills. This is what happened to one of my patients. One patient went to the endocrinologist, and the endocrinologist gave him a water pill for something about the kidney. Then he went to the cardiologist, and they found out that he got a heart failure, and they gave her another water pill. And the primary care already gave him a water pill for the blood pressure, but they all gave a different water pill. So she's taking 3 water pills, and she fainted in the middle of the road, almost get hit by the car, taken to the emergency. Because the woman was super dehydrated because she was taking 3 different diuretics. Neither doctor had the fault because neither doctor had the information from the other doctor what they give, nor the patient brought. So you cannot keep the responsibility of your health. I have a saying and a motto that I use in my business that it says, the doctor is responsible of your sick care, but you, the ones watching here, are responsible of your health care.
Of course.
Of course. Because medicine was created. Yes. Medicine was created to rescue your body from trauma, sudden illness, or disease exacerbation. Once that stabilizes you, then it's your responsibility to stay healthy.
Exactly.
But medicine was not created to maintain, because they're not doing a good job at it.
That's true. So let us go back again to the topic, and that was you advocating for your loved one. Now I have a question for you. Can you, if you do have this information, obviously, can you give us any tips or any steps as to what we should do in case that we have a loved one in hospital, God forbid, but in the scenario where we have someone in hospital for whatever reason, well, in your case was COVID-19, but I'm saying for anything, do you have any guidelines that you can tell us that we are not medically trained, that we can follow?
Yes. The first thing that you need to do, like I said, if you have that folder already with the history and everything back, that you can take to the hospital with the patient, that will be awesome. The next thing that you need to do is make sure that you are the person that they can give information, that the patient give authority for you to get the information. Because if you're not the wife or the husband of the patient, they will not give you not because you're the mother, they're going to give you. If your child is an adult child, for example, and he's the one going to the hospital, they're not going to give you the information to you if she don't give authority. So you need to already have something saying that you're the one in authority if the husband or wife is not there. But the one person that they're going to give the authority is going to be husband or wife of the patient.
Yeah, that will be the priority.
If he's a minor, then if he's a minor, then it's going to be the parents.
Yeah,
But
yeah, yeah.
if it's an adult, it's only the husband or the wife. So if it's your sister that is getting and you want to make sure that you get all the information, make sure that you got that. Once you got that, you want to make sure that you're in contact with the head nurse of the hospital, of the floor that where he's at. So you can get all information of, you want to know what they give, you want to document anything. Even if you don't know medicine, you want to document anything, everything, because that way you can do research. So you want to know what medication they doing, at what time they're giving what is the procedure that they're doing, why are they doing the procedure, that we want them to tell you why. And you want to keep records of everything. Who do you talk to, at what time you talk to, what they tell you they're going to give them. And then if it's something that you don't know, then research it and put it there. Okay, they're giving this and that's supposed to be this, and it's supposed to have the side effects or whatever. So you can have an idea of what's going on with the patient. And stay in communication. Another thing that is happening now with COVID is that because you cannot be in the hospital with the patient,
Yes.
okay, then there's nobody there, because what happens is that when you are able to be in the room, like I was with my husband at the second time, once I got healed, okay, then I was able to fight with the nurse and get things done, and they're gonna get it done because you're there. But when you're not there, then they do things at their own time because there's nobody there to advocate for the patient. Okay, so that's why you need to make sure that you got all this information, so that way you can talk back to them. Another thing that happened to me that in the hospital is that when my husband went to get surgery, he got out of surgery 4 hours later. I don't know if my husband is alive or dead, because nobody tell me, nobody called. And then finally, because I work in the same town with other doctors, I got a doctor friend of mine to call the doctor that operated my husband, to make sure that doctor would call me 4 hours later. And when that doctor called me back, he said he was mad at me. He was mad. He was like, "Oh, I got so many patients. I don't know why you want somebody to call." I said, "Because if I was there, you would have come out of surgery to the recovery room and would tell us, to the visiting room, and I would tell the family how he's doing. If that was your mama or your husband or your wife or whatever, would you like that to happen to you?" "Oh, of course not." And then I said, "But then you need to call me, because if you don't call me, I'm going to be calling you. And you're going to see me in your soup. You're going to see me in your dreams. You're going to see me everywhere, because I'm going to be calling you, because that's my precious husband there that you have there. You're not taking care of a corn. You're not making cups over here. You're taking, care of a life."
Person. Yeah, and a
Of a
father,
person.
and a husband. Yes.
Exactly. And I told him that. And he said, okay. Then after that, he called me every single day at 8 o'clock. To let me know the status of my husband. So it is very important for you to know that status. And then when you get out of the hospital, pick up the records. Pick up the records so that you can take it when he goes to the doctor. So the doctor that is going to see him and to follow up know exactly what he was done in the hospital. So those are things that are very important. So now that you're getting this information, and if you're watching this episode right now, the best thing that, if you don't have nobody in the hospital right now, the best thing to do is start building up your folder with your records. Remember, that folder is going to have, okay, the list of medications and supplements that you're taking with the dosages and the brand names and everything. It's going to have the last doctor notes, any imaging that you have done, any x-rays, MRIs, CT scan that you have done, the latest blood work that you have done, okay? And the doctor's notes. And then you also, if you suffer high blood pressure or you suffer sugar, you're gonna have a log on how your sugar has been in the last 2 weeks. Or how your blood pressure has been in the last 2 weeks, okay? You wanna put it, or if your complaint is pain, then how your pain has been in the last 2 weeks. Always have that there. I always create a log that I put in the bathroom, and it says there every day, it's a log that said, when it comes to the pain, a log that said, pain, yes or no, from 1 to 10, how is the pain, and what type of pain is it, and location, okay? Yeah. Because what happens is that sometimes knowing when it came in and what type of location, and the location and what type of pain is it, can make a difference on the diagnosis and the medication that the doctor can give you. Of course. And because things can come on and come off, that's the best thing, that you just log in that and you have it, so you can put that in your folder. Now, some people don't want to carry the folder over to the doctor, but they have now apps that you can put all this in your app. But you have to just print the page of the latest to take to the doctor, because the doctor's not going to look at your phone. You need to actually bring a paper. But it is important for you to have that, so the doctor have more information about yourself or about your patient or your loved one, so that they can take it from there when it comes. But you need to be an active active when your loved one is in the hospital. Be active of knowing. Don't let the doctor do everything. Question everything that they do. Question everything that they do, because when you question, that make them do the right thing, because they know that this person is going to ask. This person is watching for them, so they're not going to go and do the easy way out, because they know somebody's watching for them. You understand? Even if you don't know everything about medicine.
Yes.
Just
Yeah,
question, inform, and log everything. That can make the difference to life or death. Because if, like for my husband, they decided that because he was in dialysis, his blood pressure was rising up. They decided to give him a medication for the blood pressure. When I look up the medication make you retain water. So now this is a patient that cannot pee. Why are you going to give him medication that's going to make him retain water?
yes.
So I was able to, I didn't recognize that medication at the beginning. I had to do my research for that particular medication, but I was able to go to the doctor and say, why are you giving him that medication if you know that medication make him retain water if the man cannot go pee? Doesn't make no sense. So you're going to make him swell more, and you're going to make more pressure into the kidneys.
Yeah.
Oh, that's right. And he changed. You see, so that's why it's so important
It is
for us to be informed. Information.
Yes, okay.
Is the key.
Yeah, please finish.
I'm saying that information is the key. That's why even the Word of God said that if you're searching for anything, search understanding. Getting that information and understanding is the key for you to be able to solve anything. Even when you don't know, you don't need to be a medical doctor or anything like that to be able to advocate for your loved one and to be able to make sure that they do the right thing. Even when you don't know, if you're there paying attention and asking questions and always getting information and always calling them and making sure that they're always there doing the right thing, even though that you don't know exactly if they're doing the right thing, they will. Why? Because they know there's somebody paying attention for that patient. Do not let your loved one in the hospital by themselves and just waiting for whatever the doctor decides to do. Don't do that.
That's a very good advice. And that's a very good advice. Do not let your loved ones at their own devices in the hospital waiting for the doctor to come back to you with any news. You need to be present. You need to let the doctors know that you're watching and that you basically you are the advocate of your loved ones. So now to recap, Miss Aida, basically you just said a few. I just wrote down 5 key points. The first one is to have the folders with your history or the history of the loved one that you want to oversee. Another one is that once you are in hospital, or you have access to the hospital telephone number, get in contact with the head nurse and make sure that you know exactly what has been given to the loved one, what has been done to the loved one, and ask for the records for you to see if you may. The next one is, if you don't know something, once you have got information from the head nurse, always research it on the internet. I mean, the internet today is a living bookshelf that you can just go in, retrieve it, and they will give you the information that you need. And the next thing will be to, once you leave the hospital, pick up the records that you're going to be given at the hospital, so that you can take it with you into your general GP, your general practitioner, your medical practitioner, and so that they can do the follow-up for your loved one or for yourself in that case. And the number 5 will be, you mentioned earlier, but I'm adding it now, is to maintain a healthy and balanced diet. So if I have missed anything, please do let me know. But I believe that those are the first key, I mean, the most important things that you have given so far for anybody that doesn't have a medical background like yourself or hasn't been exposed to the medical field.
Exactly what you said. That's the keys that they need to do in order for them to advocate for their family members or for themselves. And these don't only go when you go to the hospital. These are rules that you should keep also when you go to your regular doctor's visit. You need to know about yourself. You don't want to give the control, like I said before, to just the doctor. Remember, they have 15, 20 people before you, 15, 20 people after you, and a computer and insurance and a pharma that they have to follow up. So you need to fight against all that by being informed. That's what's going to help.
Yeah, for the last point that I said, to maintain the healthy diet and balance, I think that it will be appropriate, since you already got the background and you are a nutrition expert, it will be appropriate for you to come back on another episode, and for you to tell us how we should maintain a healthy body, because now let us assume that we have come out of hospital, we are back at home with our loved ones, thank goodness that we are alive. Now we need to maintain, we need to maintain that body, but for that we will bring you back again so that you can tell us, you know, you can take us through the steps that we need to take, or in terms of the food, how we should eat the food and the exercise that we should do, but that will be another episode. So now,
Yes.
Miss Aida, thank you so much for all this.
You're welcome.
Wow, you gave us so much information in such a little time. But is there anything else that you would like to tell us? Is there anything that you may have thought that you have not told us so far? Is there anything that you may add before we conclude this interview?
Yeah, right away. If you have a pen and pencil, I want you to write this. Like, I'm going to give you a little bit of the things that you need in order for you to prevent the COVID. You know, things that you can do to sustain and boost your immune system. Okay, real quick. Just make sure that you're taking some vitamin D3 in a daily basis. Okay, to prevent vitamin D3. That you're taking zinc, and you're taking vitamin C. You're taking echinacea and resveratrol. And those things, resveratrol is a substance that comes from the grape juice, from the grapes.
Yes.
It's a big antioxidant. So the vitamin D3, you're going to try to take at least 5,000 international units daily. And the darker we are, because remember, our body makes vitamin D by we being exposed to the sun, but we spend most time inside because of work and stuff like that. And the darker we are, the longer we're supposed to be in the sun. So we are not going to do it because we have to work and take care of family and stuff like that. So that's why you need to take your vitamin D3. Vitamin C, you know, it's a big antioxidant and it boosts your immune system. You want to take, in a normal basis, you take 1,000 every day. But now because we're in the COVID, we suggest for people to take at least 3,000 milligrams every day of the vitamin C. The zinc, you want to take 50 milligrams every day of zinc. Echinacea is just it's an herb. So whatever the bottle says, that's what you're going to take. You take that, you get that on the health food store. And the same thing with the resveratrol, one daily of whatever the bottle says. And that's a protocol that I was taking every day, besides eating right and exercising and resting and all the other things that we're supposed to do to maintain our health.
Excellent. Wow. Yes. You've given us a lot of information that obviously we will circulate this information. So if anybody wants to follow these instructions, this is natural medicine. This is not drug, so they will do no harm to your body whatsoever. But obviously, before you take any medication, before you take any advice from us, please consult with your doctor. So that once the doctor has given you the go-ahead, by all means, go ahead, because at the end of the day, this information is to prevent and to boost your immune system, which is what we want at the end of the day. So
and you want to make sure that you're not taking any medication that might be contradicting to one of the vitamins, you know. Anyway, that's why you want to go to the doctor. Some medications might, you know, but if you're not taking any medication, that'd be perfect.
Thanks for pointing that one out. And now, any final thoughts before we leave? Or that's it from your end?
That's it. Everything is said. But make sure they tune in for the next one, so they learn how to take care of their bodies.
Yes, of course. By all means, we will bring you back, like I said, because I think that is important. Because the Bible says that my people are dying because of lack of knowledge. And what we're trying to do here at MBN is not just share the word, but also give practical solutions so that we maintain ourselves healthy and strong, because at the end of the day, God cannot operate with us through a sick body. We need to be healthy in order for God to use us, whether it is to do businesses, whether to do anything. We need our bodies to be healthy. So having said this and done, I'm going to thank you, Miss Aida, beautiful Queen Aida. It was a privilege and an honor to have you with us. Please receive my greetings from me to your family, to your husband, whom I met as well in Florida. And I'm very happy that he's doing extremely well. May God continue to bless himself, continue to not just him, but your entire family. May you continue to be blessed. May you continue to be a blessing not only to your family, but to everybody, because the information that you have given us, indeed, it is a blessing. And for you, my beloved viewers, I pray that this information and this interview has been of help to you. And I hope that, like we always say, that you become not just an ambassador, but a media evangelist, and that you share this broadcast. Share it, share it, share it. Know that here at MBN, we love you very much with the love of Christ. And we will see you again at the next episode. And until then, receive my royal salute, and I'll see you at the top, where eagles are. Bye-bye.